There's a difference between having a mood disorder, like bipolar disorder, and being moody, let's say, or being highly sensitive and highly reactive to emotional events. Sometimes it can get confusing to distinguish between reactions to situations and events and mood episodes in bipolar disorder. And it's important to be able to distinguish these two things. Sometimes in response to something bad that happens or somebody hurting your feelings, we might act out in really big ways that are perhaps disturbing to others. This is not the same, however, as bipolar disorder, because in bipolar disorder, a mood episode lasts for an extended period of time. And in fact, during a mood episode, whether good or bad things happen, we're probably going to see it through the lens of the mood episode that we're having. For instance, if you were having a depressive episode and you made a new friend, you might think about how that's going to be difficult and give you new responsibilities to deal with. Or if I'm having a mood elevation and something bad happens, like let's say I lose my job, maybe I'll think of how wonderful it is because I'm so glad to be freed of those responsibilities, or I won't have to deal with that difficult coworker anymore. This difference between mood episodes and difficulty regulating emotions can lead to misdiagnosis. And the two conditions that are most frequently misdiagnosed for this reason are bipolar disorder and something called borderline personality disorder. Borderline personality disorder has to do with difficulty regulating emotions, and the treatment for these two conditions are very different. For bipolar disorder, medication is the primary treatment. With emotion regulation difficulties, or in its extreme, borderline personality disorder, what's needed is actually therapy, a therapy like dialectical behavior therapy, or DBT, which helps you learn skills to regulate your emotions. This kind of misdiagnosis can be extremely problematic, both from the standpoint of the treatment that will help you and from the standpoint of stigma and how other people will perceive your condition. It's not infrequent that these two kinds of difficulties coexist. So some people do have bipolar disorder and also have difficulty regulating their emotions. Both of these conditions do involve changes in mood and therefore mood lability. Knowing the difference between emotion regulation difficulties and mood episodes can help you understand yourself and what's going on, as well as talk to your providers about fluctuations in mood.